Hello and welcome to our first of two Mental Health Awareness Month live stream events. Today, we will be discussing addiction, depression, and anxiety and how they are connected. My name is Ed Bottomley with the Michigan Medicine Department of Communication, and our panel today includes two experts who will help answer questions about the connection between these mental health conditions. First, I'm going to turn things over to our two experts for some quick introductions. Dr. Emily Billick, if we could come to you first.
Yes, good afternoon. I'm Emily Billick, and I'm a clinical psychologist at the University of Michigan in the Department of Psychiatry. And I'm the lead psychologist for the Child OCD and Anxiety Disorders program here. And I'm happy to be here.
Excellent. Happy to have you. And over to Dr. Cameron Coleman.
Hi, folks. It's great to be with you all today. I'm Cam Coleman. I'm an addiction medicine physician. I mostly work in our outpatient addiction treatment services clinic, which we call UMATS here at the University of Michigan. I've been on faculty here for 2 years, and I specialize in helping adult patients with addictive or substance use disorders.
Thank you both. Excellent to have you. And before we start, a few housekeeping items. You can submit questions at any time for our panel to answer during the Q&A portion of today's chat. Questions can be submitted by commenting on this video, but please note that your name or your profile name will be visible to others participating. If you prefer a more anonymous option, you can send a private message to us via the relevant social channel that you're viewing this on. If you can't stay for the whole chat or you want to share the recording with a friend, a video of the chat in its entirety will be available on our flagship Michigan Medicine YouTube channel. Okay, so let's dive in with some questions. The first one that we have up, how do you define addiction and what substances does it refer to? Dr. Coleman, do you want to kick us off with that?
Sure. So this is a great question. I think if I had to define addiction in just one sentence, I would say it's use of alcohol or substances that becomes compulsive and continues despite negative consequences. So that's really the hallmark idea of what addiction means. To expand on that a little bit, though, when we talk about addiction or behavioral addictions, what we mean is using a substance or engaging in a behavior that may start out because it's pleasurable, or it reduces pain, or it reduces negative emotions. And because of that, you may start to crave it. But over time, your use of the substance, your engagement in that behavior becomes compulsive. You lose control over your ability to regulate what you're doing. Your life may begin to revolve around it. You may even develop changes in your body. So you may develop a higher tolerance for the particular substance, or you may experience withdrawal, meaning you feel sick if you stop using it. And over time, this pattern continues despite negative consequences in your life. So it may start to affect your relationships. It may affect your performance at work. It may lead to legal issues for you. But despite these things, you're unable to stop doing it. So that's the idea of what addiction is. In terms of what substances can cause addiction, there's a long list: alcohol, nicotine and tobacco, opioids, stimulants like cocaine, methamphetamine, or prescription stimulants like Adderall. Cannabis can be potentially addictive, and sedative or hypnotic medications, benzodiazepines, things like Xanax, Valium, Klonopin, all of these have the potential for addiction.
Thank you for that overview, Dr. Coleman. Dr. Billick, I saw you nodding a lot there. I don't know if you have anything to add as well.
No, that felt pretty comprehensive. Thanks.
All right, thank you both. So the second question that we have up, is there a correlation between addiction and anxiety or depression? Can substance use disorder cause depression or anxiety, or vice versa?
Yeah, I can take a stab at that. I mean, I think it's very commonly what we often say in the business is comorbid. Like they can co-occur. We often see high rates of co-occurrence of anxiety disorders, depressive disorders, and addiction. going both ways, right? So individuals who have substance use disorders are more likely to have anxiety or depressive disorders. And in some research, it looks like anywhere from about 15% of individuals with a substance use disorder to 50% of individuals with a substance use disorder might have anxiety or depression. And the flip is true too. If you look at a population of individuals with anxiety or with depression, they're more likely to have a substance use disorder. And of course, lots of studies find different numbers, but again, probably in that same range of somewhere between 15 to 50% of individuals with anxiety or depression also have substance use disorder. And the question about what causes what, it's a complex one. It's probably a bidirectional one. For some individuals, probably having an anxiety or depressive disorder makes them more vulnerable to developing a substance use disorder. And the opposite can be true. If you have a substance use disorder, there's a lot of reasons why that might eventually lead to anxiety and depression or make you more at risk. And then there's probably some individuals for whom there's other factors that make them vulnerable to having both, right? It's not one cause the other, but you could have a family environment or a genetic factors or early trauma or stress, things like that, that might make you vulnerable to both. So it's hard to say, and for any individual, it's going to vary. There's no one predictive model, but yeah, they certainly can be bidirectionally risk factors.
Go ahead, Dr. Coleman. I see you unmuted.
I agree with everything Dr. Billick said. I think we know that these conditions go hand in hand, and it can be really challenging to sort things out. Did this come first or did that come first? It can be a bit of the chicken and the egg dilemma. There have been some studies that estimated in patients that have both an underlying anxiety disorder and an addictive disorder, maybe an alcohol addiction. A lot of studies have suggested that most often the anxiety disorder may come first, up to 70 to 80% of the time. But we also know that many patients may not actually have an underlying anxiety disorder. They may certainly be experiencing significant symptoms of anxiety. They may feel overwhelmed and stressed out and jittery and on edge. And a lot of times that can be a substance-induced phenomenon. So you may feel depressed or you may feel anxious as a consequence of the substance that you're using. This is generally really tough for us to sort out at just the initial visit. And sometimes we don't have a clear picture until we've been working with patients over a longer period of time.
Thank you. Thank you both for that, for the answers to that. The next question that we have up, what are the major causes of addiction and the biggest cause of anxiety, depression? And I could pass to either one of you first, Dr. Coleman.
Well, that's a great question. Addiction is a very, very complex condition. We know that it's a chronic disorder, it's a relapsing disorder, and generally there's no one specific cause or trigger that led to an addiction for most patients. We know that addiction involves genetics. We know it involves changes in brain signaling and brain circuitry. We know it involves contributions of your environment, the world around you, and your own unique life circumstances. So all of these things can contribute to the development of addiction. But very rarely do we just hang our hat on one particular thing and we say, yep, that's what did it.
And I would say the same is true for anxiety and depression. I mean, those main buckets of contributing factors are things that we think about and look to: biological factors, psychological factors, early experiences. All of those things are likely to play a role. But again, yeah, you can't usually identify one thing that causes anxiety, depression, or in this case, the combination with addiction.
Yeah, thank you both again. The next question that we can move on to: what are the signs and symptoms of addiction, anxiety, and depression? I understand this is a big question, so we can kind of maybe chop it up into three. What are the signs, symptoms of addiction, anxiety, and depression? And we can go to you first if you want, Dr. Billick, if that's okay.
Yeah, of course. I'll take anxiety and depression, and I'll let Dr. Coleman answer about addiction. So it can look, I feel like this is going to be a refrain. It can look different for different people. But there are some guiding symptoms that tend to be hallmarks for a lot of people. And it could be for anxiety, for instance. Excessive worry is something you might look out for. Restlessness, irritability. Oftentimes there's physiological discomfort or arousal. In younger kids, they might talk a lot about stomach aches. If we're looking at teenagers or adults, we hear about headaches, migraines, other physiological discomfort. There's also sleep disturbance, difficulty concentrating, and you'll probably hear those come up for the other categories as well. Those are not specific just to anxiety. And similarly, a big factor in anxiety is avoidance. So avoidance of the discomfort that comes from anxiety, which can be a maintaining factor of the anxiety and certainly can be a contributing factor to substance use. For depression, somewhat similar symptoms. So we will see also difficulty concentrating. We'll see some sleep disturbance here as well. You can see things like fatigue, intense fatigue or lack of energy, loss of interest in previously enjoyed activities, irritability, especially in teenagers. That's not necessarily something people think of when they think of depression, but it is a symptom for youth. And then, of course, some hallmark symptoms like sadness, persistent sadness. It doesn't just fleet and go away, guilt or worthlessness. And then, of course, we want to keep an eye out for any suicidal thoughts and ideation.
Yeah, and I can chime in here to comment on some of the signs and symptoms that are characteristic of addiction or addictive disorders. One of the big things that I ask my patients about is tell me how much time you spend using this substance or recovering from use of this substance. So, take for instance somebody who has a tobacco or nicotine addiction. Maybe they're using a vape device throughout the day or they're smoking a pack of cigarettes throughout the day. Typically, what that looks like is within about a half an hour of when they wake up in the morning and when they get out of bed, they're probably going to begin using and smoke their first cigarette or use the vape device for the first time. That pattern will continue every couple of hours or so throughout the day. It may be triggered if they experience something that's emotionally unsettling or they have a tough meeting at work. They may rely on using that substance just to help themselves feel a little bit better. And then they continue using throughout the day. So, time spent can be one sign or symptom that might suggest that there's an addictive disorder present. Financial cost can be another thing. So we'll ask our patients, tell me about how much money you're spending on this substance in the course of a week or a month. What does that look like for you? And as we said before, if there aren't consequences and if there isn't continued use despite negative consequences, then by definition, it's not addiction. So one of the things that we'll ask about is how is this affecting you at home? How is this affecting your relationships? How is this affecting your performance at work? Is this leading to any legal issues for you? Very often, patients will tell us that they have made attempts to cut back or stop using a substance. Maybe their partner, their spouse has commented on it and asked them to stop using. Maybe they've gotten a DUI offense. Maybe they've been unable to perform their duties at work. They needed to take medical leave, or they've been showing up late to work because they've been impaired or recovering. All of those things suggest that there's a little bit of a compulsive spectrum going on, and this person may have lost some control over their ability to regulate the substance. Now we're at the point where the substance is kind of regulating them.
Yeah, thank you both for those answers there. The next question that we have, before we move to, I think we had quite a few comments on LinkedIn I'd like you guys to talk on. The next question we have up, how prevalent are addiction and depression or anxiety? And how do men, women, young people all compare?
Sure, I can start just by commenting on the prevalent statistics related to addictive disorders. And I will say, for starters, that some of the statistics and numbers I'll quote for you are a little bit old. And a lot of these estimates were calculated before COVID. We know that rates of substance use have gone up across the board during COVID. We don't have a good sense of how much. So just keep that in mind as we're talking about some of these estimates. But within the last 5 years, some of the surveys have estimated that any given year, any 12-month period of time, about 14% of adults in the US will meet criteria for an alcohol addiction or an alcohol use disorder. So 14 out of 100 people in any given year. Rates tend to be a little bit higher in men than in women. And in the state of Michigan, we actually had been doing a little bit better. We were more in the ballpark of 8 to 10% of adults for any given year, compared to, again, the national prevalence of closer to 14, 15%. For other drugs, the rates tend to be lower, maybe 3 to 5 out of 100 patients may meet criteria for another drug disorder or another drug addiction during the course of a 1 year period. But over the course of a lifetime, rates of addiction are much higher. Over the course of a lifetime, rates of alcohol addiction are upwards of 30%, 25 to 30% in adults, and upwards of 10% for other drugs. Some additional comments and things to be aware of are that in general, we see increasing rates of addiction for all substances, with the exception of tobacco. Tobacco addiction has really come down in the last few decades, partly because of some of the public health measures that have been put in place. We know that we're seeing an increase in overdoses and deaths due to overdose, and that's been a really dramatic increase that we've seen in the last couple of years. Most importantly, we know that only a tiny fraction of patients with addiction actually get treatment. So it's been estimated within Michigan that only 1 out of 10 adults with alcohol addiction gets any treatment for addiction. So that's something that we're working drastically to address.
Yeah, I'd be happy to just share a little bit about the rates of depression and anxiety, things like that. So certainly also extremely prevalent. Of course, as always, these estimates range, but you can expect that somewhere around 30 to 40% of individuals experience anxiety or depression. Probably a little bit more common in women than in men as compared to the substance use disorders, which is the opposite. We also know, of course, that these rates have risen since the pandemic. And if we look at youth specifically, I'm sure you're all aware of the youth mental health crisis. We know that anxiety disorders, depressive disorders among youth really rose during the pandemic. And it continued to be a real barrier to people accessing the care that they need, kids accessing the care, because the number of providers did not dramatically increase at the same rate. So we experience a similar challenge there. In terms of youth rates of substance use, it's fortunately lower, but still, of course, concerning. Some estimates range around 5% of kids under 17 may have a substance use disorder. So lots of work to do with addressing both substance use and the co-occurrence of anxiety and depression across the lifespan, really.
Thank you both for those answers. We're now going to flip towards a comment on LinkedIn, and happily we have a few comments on our channels coming in, and we'll slip those in every so often. But this comment, I guess I have a little follow-up for you guys on this comment as well. The comment, it reads, "What is an easy way to prevent addiction?" And my follow-up would be, is it indeed at all easy to prevent addiction?
Yeah, that's a really interesting question. And I appreciate whoever asked this question. I appreciate the thought about prevention because that can be really important. One obvious answer is that if you never use some of these substances in the first place, then you're not going to become addicted to them. So if you know, for instance, that you may be at particularly high risk because it runs in your family and you've got multiple family members that have struggled with addiction, one way that you can protect yourself is just to stay away from that substance. Obviously, not everyone that uses substances is going to develop a dependence or an addiction to them. In fact, the opposite is true. Most people that drink alcohol are not going to develop problematic alcohol use or alcohol use disorder, alcohol addiction. The same is true with things like cannabis. But if you know that you're at particularly high risk because of your genetics, or maybe you've had difficulties in the past with one thing, maybe in your 20s, alcohol was really problematic for you, but you worked really hard to address that, you are still at higher risk of developing addiction from other substances. So you would be wise to be very careful if you begin to use other substances recreationally. So I think being as diligent about your use, uh, considering not using at all if you know that your own personal risk factors are high. And in general, moderation is a good rule of thumb. So anytime patients are using something every day, that's potentially worrisome. If they're needing it around the clock, if they get a little bit uneasy potentially traveling because they may not be able to use or bring their substance along, these could be worrisome indicators, and patients in that set of circumstances may try to work towards just reducing their use, maybe seeing if they can refrain from using every day and try to stick to once a week or once a month in more isolated situations.
That is such a good answer. And I only have a little bit to piggyback on, which is the part where you're saying about, if you know that you're at risk, then just either delaying or omitting using that substance at all is, as far as like easy preventions go, that's probably as good as it's going to get. And I just want to underscore that because one thing we know is a risk factor for the development of substance use disorders is earlier use and earlier exposure. So if you're a parent and you're thinking about what is something I might be able to do to help my child, delaying access as much as possible is one thing. Certainly preventing completely is great, but even if you can say, let's just take it 1 year at a time and try and push this down the road a little bit, you're probably going to be building up some prevention for your child there.
Yes, thank you both on that. And you know what? You touched on this just a tiny bit, Dr. Coleman. When should someone reach out for professional help? And what are some warning signs that should not be ignored?
Yeah, that's a great question. So, anytime there's an overdose, an unintentional overdose, and that could be because somebody may be mixing multiple substances like alcohol with opioids or other sedative sorts of drugs. If you get to the point where you lose consciousness, you black out, you become unresponsive, that is a really worrisome event. And that's something that requires immediate medical attention. If family members develop concerns that somebody's becoming impaired. They're no longer able to perform their duties at work. They're neglecting their responsibilities around the house. They're under the influence or intoxicated for a large portion of the day. That's potentially worrisome, and that might be an indication to reach out and get help. Certainly for our patients that have developed substance use disorders or addiction to opioids or stimulants that they may be using by injecting or using with needles, if they develop physical health complications, areas of infection or abscess in the skin, bloodstream infections, infections in skin, soft tissue, joints, bones, those are all very worrisome and would be an indicator that they need medical treatment for the complications of the addiction, as well as a treatment plan for the underlying addiction itself. The last thing I'll say, and then I'll turn it over to Dr. Billick, is that if people develop worsening of their mental health symptoms while they're using substances or recovering from substance use, if they become more depressed, more irritable, their sleep gets worse, if they become suicidal, if they're really struggling with taking care of themselves, then that's a concern, and that's a reason to reach out for help.
Yeah, those are all top of mind for me too. I think the only things that I might again highlight a little bit more are impaired relationships, right? If your relationships are falling apart, that's an important time to seek help. And you also don't have to wait for everything to be falling apart. So if you are just unsatisfied with the way things are, maybe you've tried some self-help strategies and they aren't working, it's okay to ask for help. You don't need to be so sick that you feel like you check some box in order to get help. We want to be able to help people who are at any stage in their journey of wanting to recover.
That's a great point, and I'll echo that. We see a surge in patients in January every year. It's around the time of New Year's resolution season. A lot of folks may be reflecting on where they are in their life and what the last year looked like for them, what their goals might be for themselves starting a new year. And as Dr. Billick said, they may not have gotten to the point where there are a ton of negative consequences, but they still may be a little concerned. They may want to make a change. They may envision a healthier life or more balanced, fulfilling life if they were able to make some changes with their substance use. If that's the case for you, if you're just ready to make a change and uh, address something that's become a concern for you, reach out. You don't have to wait, as Dr. Billick said, until the horse is out of the barn.
Yeah, thank you both for those thoughtful answers. The next question we have, another viewer question: does anxiety and stress push toward addiction?
I would say certainly not for everyone, but it can be a risk factor, and probably for a lot of different reasons, and vary by individuals. One thing I mentioned a little bit before was this role of avoidance and how it can make people at risk for anxiety disorders, but it can also make risk for substance use and substance use disorders. So what do I mean when I say that? I mean, when we have uncomfortable emotions, which are unfortunately or fortunately a part of everyday life, everyone's experience, we have different ways that we can respond to those emotions. If I'm feeling guilt, if I'm feeling shame, if I'm feeling embarrassment, if I'm feeling panic, any of these are not very comfortable to experience. And our bodies are very good at sending the signal for us to make that feeling go away, either by physically getting away from what's causing it or by numbing that feeling in some way. And so I think people who have chronic levels of stress, they are going to be feeling these uncomfortable emotions more and more and more, and may be doing things, may choose to do things to numb those feelings or to get through it. And sometimes that can be substance use and can, be part of that trajectory, I imagine. But we also know that if you have anxiety from a young age and you just get very good at avoiding that feeling, then you are going to be looking your whole life for other strategies to get away from uncomfortable feelings. So, and so again, substance use can be one of those ways. So I encourage people to, sort of reckon with these uncomfortable emotions that we all have. They're not dangerous. They are just uncomfortable. And sometimes the responses that we take to get away from them can be more of our undoing than the feelings themselves.
Yeah, I'll add a little bit to that. It's very common for folks to reach for substances to feel better. So there's this idea of self-medication, especially when stress levels are high, when things are not going so well at work for other reasons, or when they just have a lot going on in their life. Folks may reach for alcohol just to take the edge off, to relax, to calm down. We ask our patients that question. We say, when you first started using this substance, how did it help you? What did it do for you? And invariably, what they tell us is it helped me manage my emotions. It helped me numb what was going on. It helped me feel better in the moment. It helped me feel more anxious and less stressed. What we know is that a lot of these substances don't work to just cover up the anxiety as a band-aid forever. What happens is you develop a tolerance for them, you need higher and higher amounts, higher and higher doses, and then you find yourself using around the clock or taking a drink of alcohol first thing in the morning just to feel better and level things out. So yes, using substances to self-medicate for anxiety or for stress or for other negative emotions can be an entry point into the development of an addictive disorder, for sure.
One other thing I forgot to mention is a unique relationship between social anxiety and substance use because of the discomfort that individuals feel when they have social anxiety and they're placed in a social setting. It's the same model, it's the same situation of taking using alcohol, for instance, to take the edge off, but it does have the social lubricant feeling or a side effect as well, which can really create this relationship for individuals with social anxiety where they feel like they can only enter social situations when they're using alcohol, for instance. And I think that can fast line that relationship between anxiety and substance use.
Yeah, thank you both for that answer there. And the next question, which, this could possibly be a topic for a future live stream, in fact, what about the connection that all three, so addiction, depression, and anxiety, what about the connection that all three of those have to adverse childhood experiences, PTSD, and other trauma?
Yeah, that's a great question. And unfortunately, we know that there is a strong relationship, right? So experiencing early trauma, experiencing ACEs, adverse childhood experiences, they can place people at risk for anxiety, depression, or substance use, or a combination of them. There's no one specific pathway, and there's plenty of people who experience trauma or adverse childhood experiences who never go on to have anxiety, depression, or substance use. So that those pathways are still being studied, right? We want to understand, why do some people who experience a trauma, why are they very vulnerable and some are not? And there's some work looking at genetics or other factors that make people vulnerable in the combination, but certainly there are people who experience traumas who do not go on to have these concerns, and it's important to study that as well. So I'm not sure that's a very satisfying answer, because it's a little bit, at least from my perspective, I'm curious, Dr. Coleman, what you think, but it's a little bit of yes, and we don't always know. And for any individual, we can never know what will happen in their future.
I agree with that. We know that there are changes that happen at the genetic level, the epigenetic level, the way that our genes are expressed, that can be altered by these ACEs, that may increase one's likelihood of developing addiction down the road, or that may predispose them to developing addiction. But it's not a death sentence. It's not a guarantee, as Dr. Billick pointed out. One population where we see this quite a bit is pregnant women who have addiction, who are struggling with alcohol or substance use. That can certainly influence how the first couple of years go for their child. I've even worked with young patients who went on to develop opioid addiction themselves. They shared that their mothers were struggling with addiction back when they were in the womb. And I will never forget, one patient told me that the first time she used an oxycodone pill, she was at a party, maybe 16 or 17, and immediately she felt like her long lost best friend had showed up, and she didn't even realize that that person or that thing, the oxycodone, was missing. So it can have a tremendously powerful effect. And obviously, that's one story, one anecdote that doesn't explain the effect that ACEs have, but the effect we do know is powerful and complex.
Yeah, thank you both for managing that question there. A number of viewers have commented on and asked about, what are the available treatment options for individuals dealing with co-occurring addiction, depression, and anxiety? Should both be perhaps addressed simultaneously?
Great question. And generally, yes. If patients have underlying mood and anxiety disorders and co-occurring addiction, then you're going to be fighting an uphill battle if you just try to treat one of those things. So I work in a clinic, UMATS, where we have a very robust dual diagnosis program. We offer diagnostics and treatment for patients with mental health conditions and with addiction. And we feel that that should be the gold standard. So that's very common in a number of outpatient clinics, this dual diagnosis model. It's less common, but you do find it in some higher levels of care, like inpatient treatment facilities, residential treatment facilities that have a dual diagnosis focus. But across the board, when we're coming up with a treatment plan for patients that have multiple of these conditions, we generally are presenting treatment options that may include medications for mood, anxiety, may include medications for addictive disorders, and often will include non-medication options as well: therapy, counseling, other types of services to round things out.
Thanks so much for that, Dr. Coleman. Dr. Billick, anything to add from your end?
No, I think that's yeah,
Excellent.
that covers it. I mean, I could speak a little bit about psychotherapy options. I suppose just that along with what I was saying before, if you are getting psychotherapy, there'll be a lot of components to it, but part of it will be about learning to experience emotions without avoidance or numbing.
One of the things that I'll just add here before we move on is that we know that untreated anxiety or untreated depression is just going to increase someone's likelihood of returning to use with their substance of choice. And so our approach when we're working with patients is, hey, let's talk about it. Tell me about your anxiety. How are things going? Especially for patients who may be early in a period of recovery or early in a period of sobriety or early in a period of really tackling their substance use and working on change. What we know is that if we don't address the anxiety or the irritability or the sleep, then their likelihood of relapsing, as we said, is just going to go up. And we also know, like Dr. Billick said, we can't take the anxiety away. It's never going to disappear. So we work with patients on managing it and helping the anxiety levels get to the point that they can go through the day without being derailed by their symptoms.
Yeah, thank you both for those answers there. We have a question from one of our viewers. What about treating addictions to things such as sugar, salt, or fat?
Yeah, that's an interesting question and a popular area of research. That's outside my scope. We don't offer treatments for that sort of addiction or even the behavioral addiction, such as gambling disorder. So our clinic focuses really on chemical addiction, chemical dependency, and that's where my expertise is. So I can't comment on treatment options for things like sugar, fat addiction, but it's an interesting question.
Yeah,
Yeah, same.
thanks.
I don't offer those treatments either. I think if I was considering whether I would be pursuing treatment for one of those concerns myself, I would be asking a lot of the questions that Dr. Coleman mentioned before, like where are the areas of impairment? How is this messing up things in my life, causing consequences with relationships, my ability to function? And if those things are happening, then it is worth seeking care. To learn how to better manage whatever might be driving some of that. But it may not be in an addiction specific treatment center. Yeah.
Yeah, thank you both for that. Next question we have up. What role do support systems and therapy play in the recovery process for addiction, depression, and anxiety? I can jump to either of you. Oh, Dr. Coleman?
I can start off. I
Good.
think these things play a huge role. I mean, we know that recovery from addiction doesn't happen overnight. It doesn't happen over the course of 1 week. A patient may go to a residential treatment facility for 28 days, but they're not just cured of their addiction after that period of time. So patients seeking treatment for addiction really benefit from having a stable environment at home where things are predictable, support from family and loved ones, reliable social interactions, and healthy alternatives to help them occupy their time, whether that's the structure and purpose of work and employment, whether it's volunteerism, whether it's adequate opportunities for exercise and physical activity. All of these things are important aspects of someone's support system that will promote recovery from addiction.
And the second question up that we have here really bleeds into that one as well. How can family and friends support a loved one who is struggling with addiction, depression, or anxiety? So perhaps it bears repeating some of the things you mentioned earlier.
Yeah, I think those are all really important pieces of the puzzle, and broadening it from addiction to also include anxiety and depression. We know that these are illnesses that really affect a family system, or as we've been mentioning, relationships, whichever ones they may be. And so, if you are someone who has a relationship with someone suffering from these conditions, either together or in isolation, it is so important to find a way that is healthy for you to support that person. Educating yourself about their illness so that you may not be falling into some misinformation, stigma, things that are very easy and common for us to make these mistakes, but can be damaging or hurtful. So educating yourself. It can also be helpful across the board to be non-judgmental. There is a lot of stigma around all of these concerns, especially substance use, and really validating. Lots of times people suffering with these disorders are engaging in a lot of behaviors that are unhelpful, that might be really problematic, right? But the person is still a person who is suffering. And so you can validate their feelings, their struggle, without condoning their behavior. And finding a way to do that that feels authentic to you will also help you build compassion for the person who is struggling, which will help you hopefully be a better support person for them without burning out. If it's helpful to you, if you are really a part of the system, you can get your own professional help, whether that is support groups or individual therapy, whatever feels most important to you. And you probably will be working with your own support person or the providers working with this individual to identify any behaviors that you might be doing that enable the addiction or the anxiety or the depression or the combination, and finding ways to set compassionate but firm boundaries around that. We don't want to punish the person, but we don't want to enable the disease.
Yeah, I agree with all of those points. We know that family-oriented treatment for addiction tends to give you better rates of engagement in treatment, retention in treatment, and a number of other positive outcomes when you're just looking at the addiction or the substance use itself. We know that when family are involved in the treatment process, that everybody's well-being improves. The other family members, as well as the patient or the individual who may be struggling. And our clinic offers family support groups for spouses, siblings, children of patients with addiction, because the education is really important. There's a lot out there that is stigmatizing. There's a lot of misconceptions about what addiction is in the brain and how it develops and how you respond to it. So as Dr. Billick said, what can family members do? Well, they can be present, they can be supportive, they can be available, they can be non-judgmental, but they also can establish firm and healthy boundaries so that they don't contribute unintentionally or enable the process to get worse.
Thank you again for those answers there. The next question from a viewer. Now, I'm going to rewind a little bit because I believe at the beginning, very early on in this live stream, Dr. Billick, you mentioned the word comorbid when two disorders or illnesses occur in the same person simultaneously or sequentially. And this question uses that word. What are the best practices for screening or treating comorbid disorders among youth and adolescents specifically?
Yeah, it's a great question. I would say that it's really important to be thoughtful about the comorbidity piece, because we know with youth, with anyone, but with youth, because we know that the rates of substance use are lower. So people can sometimes just assume that it's not there. But the rates of comorbid substance use among youth with anxiety and depression are higher than the general population. So it's always important, if you are concerned about someone that you love, if you're taking them in to see someone, to ask about that, to make sure that they're screening for that. And certainly as a provider, it's important to screen for that. And if you're asking about like the most evidence-based, certainly there are clinical interviews that are structured clinical interviews and have been validated for assessing these concerns in this age range, right? You want someone to be doing an assessment that's validated with youth. Someone who has expertise with youth would be really important.
Thank you for that answer there. The next viewer question that we have might be something we touched on a little bit earlier. How does the care plan change when treating patients with substance use disorders like alcohol, when they also have untreated mental illness? Or more broadly, how does addiction affect one's mental health?
Yeah, great question. As we said earlier, it's really important to get a sense of if there is a co-occurring mood disorder, depressive disorder, anxiety disorder, in addition to the addiction. And if there is, sometimes you can be more confident in that diagnosis by talking with family members, getting a more longitudinal view of what these symptoms have looked like over time. But if that's there, treat it. whether that involves medication, whether that involves therapy, whether that involves a combination of things. Don't just focus on developing a treatment plan for the addiction because you're less likely to be successful. What we know is that in most cases, in the long run, if someone does have depression or anxiety, addiction is generally going to make those symptoms worse. That's certainly the case with alcohol, with opioids, with sedative hypnotic type drugs like Xanax or Ambien or Klonopin. And in some cases that we know that certain substances interfere with medication treatment directed at the depression or the anxiety. So this is definitely the case for cannabis, which a lot of folks out there may not be aware of. If you're using cannabis every day, you feel like it actually reduces your anxiety or you use it to calm down, it may be interfering with the medication that your doctor is prescribing for your depression and your anxiety. So you may not be getting the full bang for your buck from the mental health component of your treatment plan. So we know that that can be a complicated issue. We also know that in the short term, if somebody has just stopped using a substance, that if they're in the withdrawal period, which can last a couple of days for some substances, but can be more protracted and can last weeks or months for other substances, that tends to cause the depression and anxiety symptoms to flare. So alcohol certainly is notorious for doing that. Some patients, even a week or 2 weeks or a month after they stop drinking, they still feel irritable. Their sleep is disrupted. Their mood is lower. Their motivation is lower. Sometimes we can use some symptomatic medications to manage those things because generally with time, the symptoms will get better. But as we said, it's important not to stick our head in the sand and just assume that sobriety or abstaining is going to be the cure-all for the co-occurring anxiety or depression.
Thank you for that, Dr. Coleman. Our next question, and quick time check, we have about 12 minutes to go, so we'll get through a few more questions here before we close. The next viewer comment that we have, are there any self-help strategies or coping mechanisms that individuals can utilize to manage addiction, depression, and anxiety?
I mean, I can speak a little more for the anxiety and depression. Dr. Coleman, I don't know if you want to go ahead first for the addiction piece.
Sure. Yeah, I think it's an interesting question. There's a lot of people who are interested in making a change, saying, what can I do for myself? They may be listening to the podcast or reading books online. I think one important point to make is that self-help is not a substitute for formal treatment. And people shouldn't rely on themselves and their own willpower and their own discipline to make a change. Because by definition, addiction involves some loss of control. So just to drive this point home, we know that if you take 100 patients who are smoking tobacco or nicotine every day, and all 100 of them just try to stop cold turkey, generally about 100 of them are really motivated, but only 2 or 3 out of that whole 100 will be successful and still not using tobacco after a month. So motivation, self-discipline, self-help can only get you so far, and it's not a substitute for formal treatment. With that being said, there are plenty of strategies that can be potentially helpful. And one thing that I will start with many of my patients is just let's get a really good sense of what your baseline is. How much are you drinking? How much are you using? What does that look like for you throughout the day? So keeping a log or a journal or a diary can be one strategy to help us understand where we're starting. Identifying triggers, cues, situations, emotions that tie into your use. Hey, I got in an argument with my best friend, and then the next thing you know, I was driving to a bar. Acknowledging that, making a note of that, identifying some of those triggers and situations can be a really helpful self-help strategy that you can bring to your treatment provider to say, hey, let's address this. Let's work on a plan to mitigate this specifically. The last thing that I'll say is not everybody's goal will be to stop using substances. Not everybody's goal will be to be sober or to be abstinent. So if someone's goal is to continue using, then they may want to utilize strategies to keep themselves as safe as possible. So for folks who may have more severe addiction and may be using opioids or stimulants, using things like clean needles, having access to overdose reversal agents, using in the presence of someone who can look after you if you overdose. These are harm reduction strategies that we discuss with all of our patients if they're at the stage where they don't want to die, but they're not ready to make a change. That's okay. Our job is to support them until they come around to the point where their goals may evolve.
Yeah, I love all those answers. And the thing that comes to mind across the board from what you're saying is that one thing that can keep people struggling, keep people sick is shame and silence around these concerns. And that's so true for anxiety and depression as well as addiction. So self-help strategies, if you're using them because you are feeling ashamed of your substance use or whatever, and so you don't want to get treatment, that might actually keep you sick. And so there's nothing wrong with having a substance use disorder and getting help. You're much more likely to succeed, just as Dr. Coleman really eloquently said. And I think the same goes for harm reduction. In order to be able to even look at ourselves and say, here are some behaviors that I may want to change or just do a little bit more safely, we have to be a little bit accepting of who we are. And so I think that that's also true for anxiety and depression. A big chunk of the self-help work, but doesn't have to be self-help. It can be done in a therapeutic relationship as well, is removing some of the shame around these concerns and accepting what is and looking for ways to have more helpful or healthy responses.
Thank you both again for these answers throughout this live stream. Let's see how many more questions we can get answered. The next one reads, are there certain types of substances that are more likely to lead to co-occurring addiction, depression, and anxiety?
That's an interesting question. One thing that comes to mind for me is a category of medications that is sometimes used or advertised to treat anxiety, and those are the benzodiazepines, the sedative hypnotic types of medications. So Xanax, Ativan, Klonopin, these sorts of medications. It's not that these things don't work to treat anxiety, it's that they work too well. When you take them, anxiety just melts away immediately, and patients feel a good sense of relief when they take some of these medications. The problem is that they don't work indefinitely, and they wear off in some cases fairly quickly, and your body and your brain will develop a tolerance fairly quickly to these medications as well. So the cycle that we see is that somebody may start taking Xanax, for instance, to manage symptoms of severe anxiety. Or maybe they're borrowing Xanax from a friend, or they're purchasing it on the street. Within a couple of weeks or a couple of months, they're using 3 or 4 or 5 times the amount that they started with. And then they feel worse, not only because their anxiety is still there, but also because as these medications ebb and flow and as the levels go up and down in the bloodstream, you can have withdrawal symptoms from these medications that are identical to the anxiety symptoms that you started out with. So your anxiety can get worse. You can feel even more short-tempered, more irritable. You feel like your hair's on fire. You've got pins and needles. And a lot of that is just because you're in acute withdrawal from these medications. So I will say that the benzos, that class of substances, is notorious for making anxiety worse in the long run.
Thank you, Dr. Coleman. Dr. Billick, I see you nodding. I don't know if you have anything else to add.
I'm just so grateful that you brought that up. It's one thing I think about a lot because individuals with anxiety often get prescribed benzodiazepines, and not only does it potentially put them at risk for developing a substance use disorder, but just as you were describing, it keeps them locked in the anxiety. It sends the message to the brain that whenever I feel distress, I need to do something to make it go away. And benzodiazepines, like you said, do that quite well. It's efficient, and our brains are really good learning machines. And if something works really well, we're going to do it again. So that can put us in a vulnerable position where we start to feel like we I sound like a broken record because it comes back to this a lot for me. We start to feel like we can't cope with that discomfort. We need to do something to make it go away. And that gets us locked, not only in with the substance, but also in this escalating pattern with anxiety.
Yeah, and thank you both for those answers. Let's move to one last question, which comes from a viewer on Facebook. Are there significant intercultural differences in the manifestation of anxiety, depression, or differences in coping strategies?
Yeah, it's a really important question, and it's something that historically our field has not looked at enough. We've been very centered on, I'm not going to get this right, but the samples in a lot of psychology studies are considered weird, which stands for white, educated. Oh, I don't remember what the I, R, or D stand for off the top of my head. But the point is that a lot of times when we study anxiety and depression, and especially historically, we have focused on a very limited sample, and it's not representative of how everyone experiences it. And there have been global studies of anxiety and depression that show sometimes subtle differences, sometimes surprising similarities in the manifestations of these disorders. One difference that is coming to mind is that in Eastern Asian populations, there are some differences in the expression of anxiety and the way that it's talked about. So I think it's really important to continue to study and to think about what culturally responsible treatments we can develop and study the ones that we have to make sure that they work the same way in all populations if we're going to try to deliver them to all populations. And so I think it's both parts. We want to study what we have. We don't want to throw the baby out with the bathwater, right? We don't want to keep certain groups from getting treatments that we believe work. We want to make sure they work for everyone. And then we also want to be more sensitive and engage more communities and stakeholders when we are doing our research to make sure that we understand the needs and we're not just top down delivering our own beliefs onto other groups. So that collaborative approach could probably lead to better, more informed treatments.
Thank you. I don't know if you have anything to add on that, Dr. Coleman.
No, I think that was an excellent answer. We know that African American and minority populations, in some cases, are less accepting of medical treatments for addiction. And there's been some research that has shown that dates to this mistrust of the healthcare system from decades-long oppression. Things like the syphilis study at Tuskegee have made some populations a little bit hesitant when treatment providers in white coats may suggest this or that as a treatment. So that's something that's important to keep in context when we're trying to normalize treatment and trying to validate, as Dr. Billick said, our patients' experiences.
Yeah, thank you both for these very thoughtful answers throughout this entire live stream. Before we wrap up today, I'd love to ask you both if you have any key takeaways you'd like to leave with our viewing audience. Dr. Billick, any key takeaways?
Yeah, I mean, I think one thing that really stuck with me when we were talking today is when we were talking.
Addiction is a treatable condition, and in some cases, we have really effective treatments that I think are underutilized. The biggest barrier for folks who have addiction to seek treatment is stigma. So if you're a loved one and you've got a family member with addiction, understanding the role that stigma might play in that person's resistance to seeking treatment, and identifying ways that you might be able to work on that and exhibit some non-stigmatizing care and compassion. That's a really important takeaway, and that often can be the difference in somebody getting their foot in the door.
Well, again, thank you both so much for fielding all of these questions today. If you are looking for further information or resources, please feel free to visit mishmed.org/resources. That's mishmed.org/resources. And you can also visit mishmed.org/addiction resources for resources specific to addiction and substance abuse. Please also be sure to check out in our next live stream on May 25th what parents should know about eating disorders. So again, our next live stream, it's on May 25th, what parents should know about eating disorders. If you or someone you know are having a psychiatric emergency, please call 911, dial 988 for the National Suicide and Crisis Lifeline. Thank you for joining us today, and thank you so much, Dr. Billick, Dr. Coleman, our panelists, for a great discussion on addiction, depression, and anxiety. If you missed any parts of this live stream, we'll have it posted on our flagship Michigan Medicine social channels. Thank you again.